Welcome back. We're having a discussion about the things that steal your brain or assault your brain. I'm here with Dr. Mark Filidei, Director of Integrative Medicine for Amen Clinics. Mark does so many things. He helps work up toxic brains, helps make them healthy, balances hormones in the Bright Minds approach that I talked about in Memory Rescue and I talk about again in the End of Mental Illness. That's how you keep your brain healthy or rescue it if it's headed to the dark place. You have to prevent or treat the 11 major risk factors that steal your mind. And we're really talking about two of them. We're talking about the T in Bright Minds, which is toxins, and the I, which is immunity and infections. I guess Candida would fit sort of in both places. That it's like an infection. It is an infection. And it produces toxins. We were just talking, I have to get this in my head, that they use yeast to make beer and wine. And if you have too much yeast in your gut, I mean, all of us have a little bit, but if it begins to overgrow because you're eating too much sugar, because sugar feeds yeast, that you're actually in your own body creating something similar to alcohol, and that you get loopy, but without the benefits.
Without the fun part.
Without the fun part, that you just sort of feel a bit drunk, anxious, brain fog, insomnia.
Yes, and also the yeast, almost like the toxoplasma, the other brain snatcher, yeast want you to eat sugar so you can get cravings because you have yeast. It's almost like taking over your brain saying, feed me. So when you knock the yeast down, the sugar cravings can go down. That's why you want to starve it out. But another kind of scary thing that comes up with this is they've found fungal DNA in the brain of Alzheimer's patients and not in controls. It was 19 out of 19 had fungal DNA.
Wow.
So could be even more of an issue with memory. I still think the fungi issue is a lot more a problem than we think it is for many conditions.
So to diagnose it, so you can actually get antibodies against Candida.
Easy blood test,
Are there other ways people can diagnose it besides blood tests? How about stool tests?
Stool test and urine test. So there's an organic acid urine test that looks for fungal metabolites. A stool test will actually find the yeast and type it and tell you what to do to treat it. Very common, very common.
Oh my goodness. All right, so let's switch gears just a little bit and talk about infections. And I'm a psychiatrist. Why do I care? Because they cause all sorts of problems. That's why I should care. And one of my very favorite cases, and I've probably talked about Adriana a lot. She's 16, beautiful, smart, normal, goes to Yosemite and on vacation when she's 16 and her family's surrounded by 6 deer. And they think it's a magical moment. But 10 days later, she's hallucinating, she's aggressive, she's psychotic. They hospitalize her at Kaiser. And what do psychiatrists do? You have these symptoms, that equals your diagnosis of schizophrenia, and they start her on antipsychotic medications. Abilify didn't work, Risperdal didn't work, Zyprexa didn't work. And then, 6 months later, she's like shell of herself. And her mom heard about our work, brought her to our clinic in Northern California, and the doctor, her brain was on fire, and found out she had Lyme disease from a deer tick, and on an antibiotic. In California, which is actually very common. On an antibiotic, she got her life back and graduated from Pepperdine, recently got a master's degree from a university in England. She's, employed at a high-level job. And
who knows where they would have been if they weren't caught, if you hadn't have found that.
Every day about 1 o'clock, her mother texts me, how can I pray for you today? No, it's just, and I actually got to meet her about 2 years ago when I did an event in Northern California, and both of us just cried like babies. Lyme has been, you've really thought a lot about that and treated a lot of people with this.
Right.
Talk about how did you get interested in this?
So in California, we don't really hear much about it, but certainly it's here. East Coast, it's a lot more common. So it was actually my first patient at the Amen Clinic was when I really started learning more about Lyme in California. There was a kid who was here getting a drug recovery center, sober living house. And he was 21, and he had done every drug you could imagine in every way. He was injecting meth into his carotid arteries at an early age. So in his whole high school and college days were gone. It all started because he started feeling lousy. He was 14, living in Santa Barbara, got no Lyme there, feeling lousy, couldn't think right, not doing well in school, complaining that he felt kind of achy. Doctor couldn't find anything, not surprising, because they didn't look. And he just started doing drugs to feel better. He was starting to do something just to get rid of the pain and get his brain working. So that led down the typical road, wrong people, drug culture, and he became an addict. And his mother is actually the one that looked up the symptoms, and she said, oh my God, that's my son. He's got everything on the list for Lyme. And that's when the light bulb went off to me. I probably had missed hundreds of cases in the past in my own practice. It just wasn't on my radar. So now it is, and ever since, it's been all over the place. So it's in every state, some certainly more than others, but it's in California. And the most common one here is called Borrelia miyamotoi, which doesn't show up on a standard Lyme test. So you have to do a little more digging. And you don't have to have a tick bite, right? So this can come from any biting insect. Classically, it's a tick. You know, classic, you see a tick, you pull it off, you get the target lesion, you feel lousy. But it's a lot more subtle than that in many cases. So you can't go by that.
So what are the most common symptoms of Lyme? I mean, it's really been what we've been talking about. It's brain fog, it's anxiety, but also pain and trouble breathing. A
classic Lyme, like Lyme, Connecticut, which is a town in Connecticut, Lyme is pain and fatigue initially. However, there's different species. The one in Europe, Epstein-Barr, more psychiatric issues, more neurologic, psychiatric. So there's 30 different species. They all have a different little profile. So classically pain and fatigue, but it can really be anything. It's called the great imitator for a reason. It can imitate almost anything. In the DSM, almost anything in there could be from Lyme.
In the Diagnostic and Statistical Manual, you know, psychiatrists make diagnoses, and there's not a mention of Lyme, although they always say rule out medical causes.
Right,
but
who's going to do
if
that?
It's not on your radar, and many infectious disease doctors, they don't treat Lyme.
They don't believe it exists. It's outside of the classic presentation. So if you did not have a tick bite, you don't have the rash, you don't have Lyme.
Except Neuro Lyme is in all standard medical textbooks.
So neuroborreliosis is when it affects your brain. And it can be in your brain, literally. So, and that's just one, you know, of the many bugs that we look for. So EpsteinBarr virus, notorious for causing chronic fatigue syndrome.
But, you know, a lot of people have it. Like
almost everyone has had it. That's right.
But I was reading in the Journal of Alzheimer's Disease that if you've been infected, Epstein-Barr, herpes, CMV, that when you go under stress, they can reactivate.
Exactly.
You talk about that a little bit?
Yeah, so these viruses, Epstein-Barr, herpes virus 6, CMV, these are all in the herpes virus family. Now, people always freak out, and I have to say, okay, that's not that herpes. It's the same family. So it's a whole family of viruses like Epstein-Barr. They're permanent.
30% of people have that herpes, right?
Yeah, that's pretty common too.
Really
right, so that can get a little sticky.
Or cold sores is herpes 1.
Correct.
And there's actually a connection between cold sores and Alzheimer's disease. Right. And you wonder, so a lot of us have had a lot of these infections. It's how do you keep them dormant?
How do you keep them locked away? That's the key. So they're there. They're always going to be there. They can always come out of the woodwork And I'll liken this to my patients, I'll say it's locked away. Your immune system's handling it. It's locked away in a cage. What can unlock that? Stress, a car accident, a divorce, another infection. The immune system kind of just goes to sleep a little bit. The guards aren't there. Virus starts
So
acting
keeping
again.
your immune system healthy is
Critical.
so important. When we come back, we're going to talk about toxoplasmosis, because I just find that so stinking interesting. And we've had a number of cases recently. And let's spend some time and talk about how to keep your immune system healthy so you can lock these infections up for good. Stay with us.
If you're enjoying the Brain Warriors Way podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, feel free to give us a review or 5-star rating, as that helps others find the podcast.
If you're interested in coming to Amen Clinics, use the code PODCAST10 to get a 10% discount on a full evaluation at amenclinics.com. For more information, give us a call at 855-978-1363.